There's a very important dispute going on in Ireland at the moment. It's the Dunnes Stores dispute. This is important to nurses and midwives because we have also had the problem of if and when contracts, and some of you may have had to work on if and when contracts and 0 hours contracts generally. The situation in Dunnes Stores is that 80% of their staff are on those contracts, and the contracts can be used then to force them into, coming or going to work at the whim of their manager. Now, not necessarily Dunnes Stores, but lots of employers who are using these contracts are now manipulating the contracts in a way that forces people to, it can deprive them or allow them get family income supplement depending on the number of hours they get. And that's been used to get employees to do all sorts of inflexible arrangements. The impact of all of this precarious type of employment is that it is impossible for such workers to get a mortgage. It's very hard to plan for your family occasions. It's very hard to even know what income you're going to have from one week to the next. I know that some of you have had to endure those type of contracts before. There is always a need for casual or flexible workforce to some degree, but it should be a minority of the workforce. It shouldn't be 80% of the workforce. This type of employment is spreading right across the professions, and it needs to be stopped. It's Dunnes Stores workers, unfortunately, largely a female employment, who are making the stand. They deserve our support, and we should support them.
The fact that somebody can come in and tell me to move from theatre or from the maternity ward to another ward just because we're trying to level up staff numbers it's not good enough. And I'm calling on all the clinical nurse managers here today to stop it from happening, to stand up and support the staff from being redeployed from one area to another just to satisfy targets and all that type of thing that's going on. It's affecting patient care, it's affecting our nurse staffing levels, and it's affecting our mental health and well-being, and it's not good enough. Targets and performance management, it has really overwhelmed the quality and compassion that's in nursing today, and we have to absolutely get rid of this redeployment thing. Nobody can tell me what I'm competent to do, and I cannot be moved. We should not move unless we really know where we're going to and you're competent to go there. And I call on you all to stand up and be counted, no matter who's coming in, director of nursing or otherwise, to tell you to move. We've got to look after ourselves, our own registration and the patients that we look after. And if you really feel you are not competent, then do not move. And the INMO and the industrial relations officers and the reps will support you in this.
And she said, I want to reduce by 1 day. And they said, no way, 39 hours or nothing. So they've lost her now. She's handed in her resignation and leaving. So they're losing somebody with key skills, educated to master's level, critically care trained, highly experienced. So it's better to have somebody for those, 4 days, 3 days, than losing them totally. So I ask you to support this motion.
My fracture in my foot was sustained during an accident, during an arrest. The patient lived. I was out for 4 weeks. I was very glad he lived. I broke my foot for him. We need to lobby our TDs. Nurses need to be looked after.
I can just see the headline now, nurse breaks foot but saves patient, or something like that.
I'd like you to support this motion, but to also add that if you're an A-stamp PRSI person, you actually don't get paid for the first 6 days of your sick leave. So I was never sick until last year, and I had 2 episodes of sick leave, and I didn't get paid for 2 episodes of 6 days. So I was without a salary, we'll say a fortnight salary.
Further concerns for members have been its abject failure to demonstrate a true understanding of the conditions registrants have been forced to work in recent years, culminating in the inexcusable number of patients on trolleys reaching 600 in January this year. In its role of protecting the public, not formally acknowledging the loss of 5,000 nurses in such a short frame of time, notwithstanding the years of experience that have additionally been lost, was and is a mistake.
When you go on duty and and all the roster staffs are available and nobody's moved to any other ward. That is respect. When you need advice with an issue regarding patient management and a nurse manager is available to help you, that is respect. When your tea break comes around and you go and you get your cup of tea, that is respect. When it is time to get your unpaid lunch break, you get your lunch break. That is respect. When you're meant to finish your shift at 8 o'clock and you finish, that is respect. When you go home at night and you have the energy to engage with family, that is respect. When you are off duty and you're not phoned to come in and cover an absence, that is respect. When you take and you are sanctioned your planned annual leave and it is not cancelled, that is respect. When you are paid your correct pay and it is your right and it's not just an entitlement, that is respect. We need to respect each other more as nurses, and the HSE need to respect us. Thank you.
We're still back to the same thing of bullying in the workplace, and it's still not acceptable anymore. There should be a penalty, especially for higher management, that disrespect staff in any way, including all the way that ways that Patricia has outlined. And the penalty should be that they attend courses on counselling and on bullying, and it should be a mandatory thing for management to attend these courses and let them be shamed and named, for what they do. Thank you.